Hi, everyone. Welcome back to my channel. Today, I am with Dr. Patel, who is a neuroradiologist in Texas. He's in private practice. And while most of my videos focus on the path to radiology and how they found their subspecialty, today we're going to be talking about your path to private practice. So welcome to my channel.
Thank you. Thank you for having me.
So this is really important because a lot of us, including me, are starting to think about jobs and kind of what pathway to go. And this whole landscape is changing. So what made you go into like neuro and then specifically find a job in private practice?
Right. Neuro, I guess of all the systems, that's the one I like the most. I found it to be the most interesting. It's just a natural fit. So I went with neuro. I also like the fact that I had to take a CAQ, which meant I actually have another level of specialization, which I just felt makes me also more marketable. That was yet another thing. So it worked out well that way.
Yeah, that makes sense. So actually kind of going off of that, is there something that you think makes residents more marketable for private practice we can do?
Yeah, I think there's a lot of things, I've kind of just taken this, each private practice is different, right? Right now we have some groups that are small, maybe, 15, 20 people to the mega groups, which are, 80, 90, over 100. So some of the mega groups, you can probably drill down and specialize in what your training was, for example, and say, well, I don't like to do this. I don't like to do that.
Mm-hmm.
You're looking for some mid-range groups or smaller groups. You're going to have to do a lot more than just maybe what your favorite things were in residency or what your even specialties. For example, being a neuroradiologist, I still read mammos. I do PET. The only thing I don't do is MSK MRI because the orthopedic surgeons wanted MSK grads to read it.
Okay.
And I don't do a lot of body or prostate because when I was in training, it was still in its infancy or non-existent, right? Like there was no prostate MR, and body was, attending would spend all day on one case kind of thing. So, and it's all changed. But everything else I do procedures, I do drainages, I do, random stuff that I didn't do in training. Okay. So you just have to keep yourself open to new experiences because radiology, just like any other field in medicine, is constant learning, right? You're never done learning. You have to be open to new technology, new things that come. And you can have the things that you're more comfortable with, more favorite, that are your favorite. But that's kind of important, I think, for anybody that at least that we're looking for, someone who's willing to take on a few things that the group needs you to do, kind of thing.
Got it. And was this something that you anticipated coming out of residency, or is this something?
Not at all. I was like, I hate mams. I've never treated mams. And the reality is I need to do mammography because of just how our practice is structured. And it's fine. I mean, it's not my favorite, but it's not the worst. I find satisfaction in it. I'll tell you that, because when you do find a cancer, you actually do get to talk to that patient and you actually do the biopsy and you get the path result back, good, bad, or somewhere in between. At least you've changed their management, right? If it's a cancer, they don't like the result, but they are happy to have the result because now they can start treatment. Right. If it's not cancer, they are extremely relieved that it's not cancer. And they're happy that someone took the time to, kind of walk them through that process and give them a result and kind of just answer any questions that they had. So,
yeah, no, I agree. I mean, I'm applying for a breast fellowship right now, so I totally get that part of it. Yeah. When you were looking for jobs, were you only interested in private practice or did you also look into academics?
No, I wanted a private practice job. So, I think all of this has changed a lot since I started looking for jobs about 16 years ago. So I've been at my current job about 15 years. So it's the first job out of training. Back in the day when you had private practice versus academics was in a university or teaching hospital setting. You had faculty, you had residents, you had fellows. The case volume was not a lot, but it was very challenging and interesting because you got all the cases that people couldn't figure out, or you had the complicated patients who had to come to that tertiary care center to be taken care of. You got academic time, you got time to do research, publish, et cetera, et cetera. Private practice back then was smaller groups, right back then. Mm-hmm. Community hospitals, you didn't have as many specialists, so you were general radiologists for the most part, maybe occasional specialists. A lot of the specialty work was then referred off to the tertiary centers. As time has gone on, they've kind of almost overlapped is the way I think about it. Academics, the volumes have gone up. Your professors and attendees probably telling you we're reading more now than ever, more complicated cases now. than ever. They're being pushed to read. Research is kind of getting pushed back. The ability to publish is also getting pushed back a bit because the volume is so much. They're just being asked to work. And they're probably not. Back in the day, my attendings would come, read for like an hour, go away for 2 hours, come back, read you. But more and more, they're probably there a lot more now because there's a volume requires it, right? In terms of private practice, the groups are getting bigger. And because they've gotten bigger, they're subspecialty reads now. So you have a neuro division, you have an MSK division. So you are not sending those cases out. You're actually reading them internally. So you're actually taking care of complicated patients. Hospital systems are so much bigger now that they're doing that. In terms of teaching, there are private groups that have residency programs now. So it's not just exclusive to, the traditional academics. So I think there's actually a bigger overlap now between private practice and academics than there's ever been because there's just a demand in imaging and radiology.
Right.
What makes us still different is in private practice, you're still an academician, you're part of a department, you are not an owner. You're employed, and that's the track. And that's a good track. I'm not judging it. The difference to me of what a private practice now is or should be is you are an owner. And by owner, I don't mean that means you're going to get a bigger paycheck. That means you're responsible. You're now responsible. You're a part owner of something. In this case, it's a practice that does imaging. So you have to be an owner mindset, which is not show up at 7, leave at 5 and say, that's it, I'm done. It's somebody else's problem. If you want to be, in my opinion, a private practice doctor in this day and age, the differentiating factor is your mentality as to taking ownership of that group, saying, what do I need to do to help that group succeed? That goes above and beyond just reading my images accurately, succinctly, and taking care of just patients. That's all expected. That's expected in any practice, academics or private. It's that other intangible stuff because it's your practice. And if you don't put that extra effort in, and whatever that effort is, it's on your talents, right? Like if someone is really good at physics, well, then you should be the MR safety person or the person who handles that part of the practice. If someone's got a finance background, then maybe you should kind of be a little bit more involved in some of the finances to make sure your billing is okay. Or you find your talent or your interest, and that's how you contribute above and beyond. So to me, that's now the difference is ownership versus just a more traditional model.
Yeah, I think that your point about things being overlapped like much more than ever, I think it's a totally great point. I never really thought about it as even private practices are having residents, but that's true. That is, there's just more and more volume in the academics and then also residents and teaching within private practice. That being said, I think a lot of residents still feel like in private practice, you're going to get paid a lot more, but you're going to work a lot more. And academics is more like you get paid less, but it's less work overall. Do you feel like that's?
There's still some truth to that, but I think the gap is shrinking. Yes. Right? Because payment is all about reimbursement and contracts and blah, 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 so in theory, yes, it's still some truth, but where they were probably very separate, now there's an overlap that wasn't there. But I do think that that's the case. Traditionally, an academic practice will have residents and fellows. You can probably leave at 5:30 and you're done because there's already going to be somebody on call. And it's probably a resident or a fellow, or there may be an attending, but it's, you know what I mean? It's far and few in between calls. In private practice, if the work's not done, you're not leaving at 5. You're going to stick done. And you are, in theory, yes. In theory, you'll make more. And in theory, you'll work harder because that's the only way to make more. Right.
Now, I think something else that's on the mind of a lot of residents these days is the consolidation and corporatization of private practice. I'm sure you've probably seen that around you as well. We all have. What's your opinion on that? Like, how do you see that changing private practice?
Well, I don't think it's going to go away. I think there's a lot of money that's been already spent to acquire groups and practices.
Yes.
So there's going to have to be some sort of ability to work together, if you will, between a private equity owned group and the private practice groups. Again, the difference is kind of the same thing. You're still going to work, but now you in theory have someone else kind of somewhat controlling the ship. I know that a lot of them will say, well, locally, you're still in charge. You decide when you're off. You decide who's on call. And that's true for the most part, as far as I've heard. I've not heard anybody tell me differently. But at the end of the day, the contract that was once under your group's name is no longer under your name with that hospital or that imaging center or whatever that health organization is. That contract now belongs to that private equity group. So at the end of the day, when issues come up, they may deal with you, but they really got to deal with somebody above you. You're not going to you don't get to make that decision.
Yeah. That's the main complaint that I've heard about the corporatization is that you're no longer in control, and things can happen a lot of times without even your knowledge, happening behind closed doors. And now your practice is different. That's kind of the stories that I've heard.
But it's real. I mean, with the amount of groups that have been acquired, right now the job market is pretty good. You can probably choose one or the other if you wanted to. If maybe that's the kind of route you want to go for whatever reason, and our private practice is the route you want to go for another reason. There's enough jobs out there right now. I think you just have to figure out what is important to you as an individual. Some of this comes down to geography. If you live in some parts of the country, there may be a lot more independent groups, there may be more academic jobs, and there may be more private equity jobs. Skill set and interests also, and kind of what your time horizon is, or if you're looking to work maybe 4 days a week or something, that all those things have to kind of play into what is right in terms of you.
No, absolutely. And I think sometimes, actually, I would say that if you are looking for private practice or academics, a lot of times you can find the job you want in either practice. Like there are private practices that want part-time people, and there are also academics that can use that too. Yes,
you guys are in a very lucky time period right now, and this stuff is very cyclical. Probably 4 years ago it was not as lucky.
I was going to say, when you were applying, was it a hot job market, or was it
was hot the year before? Mine was very warm, I'll say.
Okay.
But it wasn't like it was literally the year before for whatever reason, right? And if you look at last year with COVID, the job market off a cliff in March. There probably all the jobs went away. You couldn't find a job. And suddenly in October, all the jobs kind of came right back up. So this is a great time for somebody who's coming out of training to find a job that they want, because there's a lot of opportunities out there.
That's good to hear. That's really good to hear for those of us that are starting our search. In terms of looking at private practice contracts and red flags, I know I'm really curious about this myself. Are there any things that you would say avoid at all costs, or just any advice you can give?
Our contracts are pretty straightforward.
Standard.
In terms of contracts, I think I'll take a step back and say, I would look at the group's culture, right? If it's a group you trust, or a group that has a reputation of not stringing people along and then just cutting them at the last minute, but a group that's fostering your career, through the years, whether it's 2, 3, 4, 5 years apart, or whatever that tract is, as long as they have a culture of being fair, that's, I think, first and foremost, because chances are then the contract's probably going to be fair.
Okay.
If they have a culture of kind of, doing things, and there's groups out there that have that reputation of kind of cutting people in the last minute, or they just burn through people. The people stick around for 1, 2 years and they leave, and they're okay with that because they always get a new recruit because they're in a geographically desirable place. So they're okay with just burning people through, because that gives them, first year employee makes less than a third or fourth year, right? So they're okay with dropping, because that money is back in their pocket, right? So I would say the first important thing is culture. Because if you feel comfortable and you feel the culture is a good thing, that's the first step, right? Then in terms of the contract, like I said, our contract is very straightforward. I think I would probably check out a few things. I tell everybody is if they have a section for grounds for firing is always important. Okay. Because they may put little stuff like tardy or something. You may not realize it, but you may be showing up 15 minutes late every day. Nobody says anything to you, but then when it's time for your review, they go, you were late every day. You're gone. I've heard stories like that. And maybe that's a little urban myth. But the other most important thing is the non-compete. Okay? Because the non-compete, even if you live in a big metropolitan area, if their non-compete is a large geographic area in multiple years, even if you're living in a big city, you effectively would have to move, because their non-compete would prevent you. Because if they own multiple sites throughout the city or the urban area, and they have a 5 or 10 mile circumference, they've effectively taken up the whole place. So
What's a reasonable like mile area for a non-compete?
It's per state, the rules,
Okay.
but because it again also depends on the area, right? If, for example, like if you're in a place like North Dakota where there's not a lot of spaces, so they may be a little longer because that group has such a wide area of coverage that they may have a wider, but someplace like New York, they may be like quarter mile. I don't know, because there's so much congested that they may have. So a lot of it's state dependent. Now, in terms of years, it's probably a couple, 3 years is probably reasonable. It shouldn't be too long. Now, each state has kind of some precedence in this. So I think if you, if you get the contract, you should still get someone to look at it. That's what my first advice is. Find a lawyer to look at it, because nobody should have an issue with you looking at the contract. Now, that's going to come out of your pocket to look at the lawyer, but again, it's your career. It's going to cost you whatever. It's not going to be crazy expensive, but it's worth spending that money, investing that money to make sure you don't sign a contract that has some serious issues. And often those employers will not change the contract because they're not going to, change it for everybody, especially a new employee who is coming fresh out of training. If they're trying to get somebody who's a world-renowned radiologist, they may change the contract for them. But more importantly, the lawyer then can explain what it is, and you just got to decide what you can live with it.
Okay, that's good advice.
So that's kind of what I would recommend on contracts. Make sure you like the culture and get a lawyer to look at it, and then make sure you can live with the constraints or not.
Okay. Second to last question.
Sure.
How do you find out about culture? Because that is something that I know a lot of us struggle with.
No. So if you know of a group you want to practice in, I would start reaching out.
Okay.
Talking to them. Or ask people. The thing is, your reputation will be farther than you think. Okay. You can always pull up the list of, most places have a list of radiologists. Often they will also have their education in there. And you go, oh, this person's trained here. Hold on. I know somebody who's attending there right now. Then you may reach out to them and say, hey, do you know this person? They say, oh, yeah, I know him. And great guy, great. So there's always ways to find out indirectly about a practice. But more importantly, I think it's just to reach out to the practice if you're really interested, because it shows that you want to be a part of them. A lot of groups don't always post a job till it's job time, but they're sometimes even thinking about it. They just haven't gotten around to posting it because, like, I'll just wait till job season, right? Job season historically is you start about July, August when the new fellows are ready, and it probably runs about January, February, maybe, right? That's the tail end of it. But if you're interested, I would reach out. I would go to your, like, for example, we have the TRS here, Texas Radiology Society. So they actually have an annual meeting. A lot of the groups come, and the residents come too. There's a resident section. You go and you talk to the people. That we all will have a booth. You go to the booth. You talk to people. You meet the 2 or 3 rads that may come and represent the group. And yes, they're being judged. If you're not nice, they're just going to assume your group is not something I want to further explore. Right.
Right.
I think it's important. I know that the job market's really good for y'all right now out there, but I think if you guys are interested, there's no reason to wait, at least to start getting the feelers out there, start learning about some of the groups that you may be interested in.
That's really good advice. Yeah, that's as soon as I finish my core exam, that's the next thing on my list is to start looking for a job. You've given us so much wisdom. I don't want to take too much of your time. Any last minute things that you can think of? I know you've already said a lot. So
no, I think just, find the place that fits for you. I think I'd done all these ACR leadership things, and they were talking about, recruiting and whatnot, and a couple of things that hit home, but they always said the first most important thing was the culture, because it wasn't how much money they were making, and it wasn't just the geography. It was really the culture, because you're going to go to work 10, 12 hours a day, 5 days a week. You have to be happy, and you have to like the people you're working with. Otherwise, it doesn't matter where you live or how much money you make, because you just won't be professionally happy anymore.
Yeah.
Right. So that's what I would recommend, is find a job that suits you, suits your personality, that will also support you in your success, right? You want a place that's going to take a young person who's just come out of training and help them build their career. That's what I tell all the, you're not kids, but all the interview candidates, when they come, I say, I want this to be your career, not a job. I want this to be your career. So
that's really excellent advice. And I'm sure that we all would benefit from more radiologists like you out there. I know some places do have radiologists that are more cutthroat, but I appreciate your advice and
pleasure.
how welcoming you have been. It's been really nice talking to you. Well, I think that's all I have. Thank you so much for talking. This was really excellent and enlightening for us. So,
All right. Thank you.
thanks.